We are a full service law firm with more than 85 attorneys, all focusing on healthcare. We have 6 different offices. In New York, we're in Great Neck and Albany. We're in New Jersey and Hackensack, Connecticut, and Stamford. We have an office in Washington, D.C., an office in South Florida. The law firm's been around for 40 plus years, and as always, we give all of our attention to our clients and focus on issues big and small. Taras and I, we both focus on IT and data security matters mostly, and that's what the majority of this presentation will be. And I'll turn it over to Taras to begin.
All right, thanks, Zach. So I'm Taras Chiviniak. I work in the Great Neck office of Garfunkel Wild. Zach is in the Stamford, Connecticut office. And we both, as Zach mentioned, work on health information technology contracts. Can everybody see the presentation? I'll switch it to the first informational slide here. Just want to make sure everybody can see it.
Yep, it looks good.
All right, perfect. So we'll start here with tracking technologies. This has been a bit of a hot topic that became, or I guess that heated up quite a bit over the past year. And I think maybe the first question that we may be asking ourselves is, why sort of talk about this? I think a lot of the world has become very accustomed to being tracked online, at least to some degree. We sort of know that it's happening. We know that Google and Facebook are tracking our activities, at least in some places, certainly on their websites. And then they're building a profile of our interests, and then they're giving us advertisements on the basis of those interests. So I think, as a baseline, we all understand that. But I think where it really gets interesting is once we start to understand exactly how far reaching the tracking goes, how detailed the information is, and then how this may impact medical practices such as yours, as well as your patients. So that's really where we're heading with this presentation, and trying to educate, just to make sure that your practice is well positioned to comply with the laws and avoid certain pitfalls along the way. So on this first slide, I wanted to cover, what are the various tracking technologies that may be involved, some of the vocabulary here. Many of us have probably heard of cookies. I know for many years we have to keep clicking those so-called cookie banners that pop up on every new website. They're quite annoying. There's a question whether they're required or even effective. But what those are small files that are created by servers of the websites that you visit, whether on your mobile device or on your computer. And these little files, what they hold is information that helps that server figure out what content to serve on that website. These are stored on your local device. And most of the time, really, cookies are required for even just basic functionality, whereas other cookies exist just to serve advertising, build profiles, and things like that. Here you can see a list of functionalities that are relevant to medical practices, most likely. So you have access to information, for example, billing, website performance and functionality, analytics, who's going to your websites, some fraud prevention features, as well as advertising. So that takes care of cookies. Now, pixels, these are small bits of code that are actually added to a website that enable the tracking of your online activity. So you can think of a pixel, I guess there's a couple of different ways of thinking about it. One is a listening device. If you listen to some of the legal plaintiffs that have sued certain website providers for looking at private information. So you can think of it as a listening device, and it takes information about what you do on a website, and then it sends it to third parties who can do a number of things with that. One could be serve up analytics to say, hey, medical practice, you have visitors from California, a lot from Connecticut, from New York, from New Jersey. So that's analytics. And they can also look at your profile for advertising purposes and select advertisements that may fit you. Another analogy that I would say is kind of like a window looking into a business establishment. So you have Google, you have Meta, other companies that are kind of looking through the window to see what you're doing, and then they're reporting back to that business. but they're also using that observational information for other purposes. Now, the key thing to remember about pixels, so this is code that's added to the website itself, and you have to think, well, who's adding it? Typically, that's the web developer that's working for the medical practice or for any business that's using pixels or tracking code on the website. And that's really why we're here talking about it, because pixels, they don't just kind of appear out of nowhere, but they could be added to a website by somebody who works in the marketing department. Maybe they've picked up some tips and tricks from a different organization that they worked for. They found the analytics helpful, and now, maybe they're adding it to your website. And so those activities and the results of those activities would be associated with the business that's publishing the website. So that's why we're here talking about it, because that could be your website.
Yeah, and Taras, there was a question that was asked about, if it's possible to use websites without being tracked. Potentially that's possible, and you can block certain things, but what this is really going to talk about is on the provider's website that they have, they might want to track certain things, and kind of how do you do it in line with the law, and what might you do that crosses the law.
Mm-hmm. Yeah, and we'll certainly be getting into some of those topics in the coming slides. You can turn off tracking technologies. You can, for example, turn off all cookies, third-party cookies, and the tracking. You'll always get that warning that, oh, the advertisements that you get might not fit your interests as well. And I think we're probably all fine with that. But then a different effect may be, hey, the website might not work at all. So for example, if you turn off all your cookies and then you try shopping on Amazon, good luck, because it's probably not gonna work. So there are some fundamental cookies that you likely need to accept for that functionality. Others you don't have to, but it is tricky. And then for that second part of the question, Zach, in terms of where do we cross the line? So we'll be getting into some of that detail in the later slides. So just before moving on, I did want to also mention the third category of tracking technologies that we're thinking about here, which is the advertising identifiers. And these are identifiers that are actually programmed into your mobile device. So I have my Samsung, I also have my iPad. Each of them has its own identifier. And really the purpose of that is to enable advertising profiling for users. But then if you take all of these technologies together, all of them feed into a profile that's kept by Google, that's kept by Meta. And so, what we want to do is dig in a little bit more into the types of information that we've actually seen in real life situations that may be sent out to those companies. All right, so let's move on here. So where are these tracking technologies? You may have noticed, they're really everywhere. At the browser that you're using at your computer, maybe use multiple browsers. Each of them will be susceptible to this. The devices that you carry around in your pockets, certainly. And so they connect the internet activity from all of your devices into a single profile. We've already mentioned Google, which runs an analytics platform. We've talked about Facebook, which is now, I guess, converted to Meta. So they have a tracking technology called the Pixel, as well as Amazon for shopping and advertising. Adobe, wireless carriers also use these technologies. And what we found, and also what the government, more importantly, has found, is that many healthcare providers, whether knowingly or unknowingly, are utilizing these trackers on their websites. And so what they've started doing is actually educating users on these technologies. So earlier this year, Health Affairs magazine, they did a study of many top healthcare provider websites, and what they found is that really close to 100% of them use Google, so Alphabet Analytics, and other tracking technologies on their websites. The next one that came up was Meta or Facebook, with over half, Adobe Systems with about a third, AT&T with about a quarter. So you really see this mix. And I think last year what happened is that HHS, the Health and Human Services Department, issued a bulletin that was really intended to, I think, educate healthcare providers on the use of these tracking technologies, give them caution, a cautionary note about using them and how to use them. And so we'll go into some of those details a little bit later as to what they said. There have been some lawsuits that say, well, this bulletin isn't merely explaining the law, it's actually promulgating a new rule, which would have to go under a separate process. So the government is being sued for this guidance, this bulletin, in the way that they're characterizing it. But let's go into some of what these tracking technologies and these pixels do. So just here in the upper left, just randomly, I visited the New York Times. I have this small tool that tells me how many trackers are actually on this website. So for the New York Times, the tool told me that there are 16 trackers. And then you see some of them here, I guess the advertising group. So advertising is one main use for these trackers. You can also use them for things like content delivery, audiovisual content, even for interactive site features like patient chat, commenting and forums and things like that. But advertising is really one of the main features. And here on the right, what I wanted to do is show the output that I located. And honestly, this really shocked me when I saw this. I visited a website of a healthcare provider, and the website, it has a form. You can be interested in searching for providers and specialties, and also trying to schedule some time with your provider. And then as part of that form, it actually had a drop-down selection for the condition that you'd like to see a specialist for. And if you can see, sort of the lower part of the right hand of the screen where it says button text, highlighted in yellow, heart health and cardiovascular disease. And so that pixel was able to pick up the fact that I had clicked that option. I didn't click anything else. That was all that I did, is I just selected that as I was going through the form, and Facebook was able to receive that information and add it to my profile that I was apparently interested in this. So if you can imagine, heart health is already health information, but you can have health information that's a lot more sensitive as well. You could have certain disease diagnoses that maybe are sensitive. You could have reproductive health services that you're looking into. And so Facebook, Google, Adobe Systems, AT&T, they may potentially be getting all of that information depending on the configuration of your tracking technologies. Well, we've been alluding to this a little bit, but really, what is the core issue with using these tracking technologies from the perspective of a healthcare provider or medical practice? So HIPAA really is the big issue. I'm just pausing there because private lawsuits are also becoming a big issue. But let's start with HIPAA and how HIPAA applies to this. So a healthcare provider or medical practice cannot share a patient's health information with a third-party entity unless that third party, which could be a vendor, is considered a business associate that has signed an agreement called a business associate agreement and is performing legitimate functions for that provider. So if your website uses that tracking technology, then your practice may be sending protected health information to those other entities. But to do that correctly, you would need to set it up right under HIPAA, which means that you have to enter into the BAA with those vendors. The Health and Human Services guidance divided the world of web pages into user-authenticated pages and non-authenticated pages. So the authenticated ones, your patient may get a login, they sign into your website, and then they start, paying their bills, making appointments, and looking at their health data on your portal. So that's a pretty big no-no to put tracking on those pages. As for non-authenticated, you would think, well, if sort of a random member of the public is visiting the site, they're not authenticating, then there must not be any issue, right? So that's not entirely correct. What we found is there's really a range of web pages that may appear on somebody's website, and some of them are very closely tied to a medical condition. And in that case, if it gets kind of too close to being associated with a medical condition of the person who's visiting, then that could also be considered PHI and trigger these requirements. But one of the difficult aspects of advising clients on these issues is that there's no bright line for the non-authenticated pages. Many of them are in a bit of a gray area, but I think there's a safer part of the gray area and then a more risky part of the gray area. So that's really how we advise on these issues. As we mentioned earlier, the tracking technology is very much on the government's radar. And what they've said is, although online tracking technologies can be used for beneficial purposes, patients and others should not have to sacrifice the privacy of their health information when using a hospital's website. And that's consistent with what we've seen. Now, specifically, Google and Facebook or Meta, those trackers are used very frequently across many websites, including healthcare providers. The problem is that neither of those sign that HIPAA business associate agreement for the tracking technologies. And in fact, if you use them, there are certain provisions you have to add to your terms and conditions for your website, possibly your privacy policy. And for providers who don't actually take those extra steps, and I'll be honest, it's very few that actually do that, but there could even be potentially a contractual problem or issue with Google or Meta.
Taras, so another question came up about, are web designers generally aware of these issues? I'll let you answer that. See if I don't, my answer is probably only some of them, but I don't know if you have a better answer than that.
Yeah, that's really an excellent question. I'll be honest, I've had, a handful at least of calls with the web designers and the marketing folks. I think they have general familiarity with HIPAA overall, and I think they have to, just being employed by a healthcare provider, but they don't necessarily see the HIPAA issue with putting tracking technologies on a website. So it's definitely an education opportunity for those who work on the websites, as well as an opportunity to educate leadership as well about how these issues can come together. And so what we found is, there's not going to be necessarily one person who's going to have all the knowledge. So typically we bring together us as the lawyers, and then also leadership with our clients, and then also the web designer or web programmer at the clients.
Yeah, I would just add to that, Taras, if you as a provider are counting on if you have a web designer doing your website, if you're counting on them to know all the lines of where you can cross and where you can't cross with this, they probably don't. They might have some awareness of something, but I don't think that like Taras said, we know the full picture without talking to the administrative people at the provider's office, without talking to the attorney, without, I think there's probably few and far between who know the whole soup to nuts of what's the right way to do all of this.
Yeah, that's exactly right. And one thing that I would actually add associated with that is that I've been quite surprised by the creativity of how marketing personnel like to approach, some of their, patient-based building projects. And there are different ways that you can, for example, hit targeted ads or custom audiences in Google, in Facebook, so you can push different kinds of advertisements out into somebody's Facebook feed, including a form. So then Facebook is collecting information, sending it back. And then I know a lot of marketing personnel also want to have visibility into, what's the effectiveness of my marketing dollars. So then, they pay for these advertisements, but then they want to know, for the, X amount of dollars that they spend, how many folks actually went to the website. So that's kind of one type of tracking. And then how many of them actually scheduled appointments and became patients if they're new. So that's a second sort of level. And you do have to analyze all of those pieces and all of those journeys of the data separately, because the answer can be different for each piece of that. So I found myself, listening to what the marketing plan is, or what the proposed activities are, and then giving some advice, this is more risky, this is less risky, this is how you can make this less risky, while still meeting your own imperatives to try to figure out, are the marketing dollars being used well and spent well? So that was a good question. Moving back to the slides. So another risk of the tracking technologies is we're also starting to see many more private rights of action. So this simply means that it's not the government suing healthcare providers. The government uses a lot of discretion. They tend to go after the larger players. The difficulty with a private right of action, there's a couple. One is that anybody in the United States can initiate one. And then second, if they start coming together with other patients, people with a similar claim, then they can do what's called a class action. And then they can band together and they can sue different health practices, healthcare providers, health systems even. And that just raises the level of risk, because Now you have a very motivated and dedicated team of attorneys who are trying to get at least some money from the system or from the provider. And these suits can be very, very expensive. Now, on the previous slide, we talked about how HIPAA is implicated with these tracking technologies. But what we've been seeing in these private class actions is that they're starting to look for other types of claims that they can add because they can enforce them. So there are state and federal claims, Electronic Communications Privacy Act. There are a lot of different invasion of privacy laws that can be asserted. Unjust enrichment, you're taking my data, you're making money, I'm not, so you shouldn't be doing that. Breach of implied contract terms, professional negligence, and state privacy laws. There was one report that estimated more than 50 private lawsuits filed against hospital systems since last August, I guess 2 Augusts ago, relating to these tracking technologies. And as I mentioned earlier, these are totally separate from the fines and enforcement actions that may be brought by the government, which themselves can reach into millions of dollars for HIPAA violations. Just some notes on recent settlements in the past couple of years. So January 2022, Mass General Brigham had an $18.4 million settlement in a Massachusetts class action over the use of tracking technologies. And then just a couple of months ago, Advocate Aurora Health settled their own private class action for just over $12 million. And this also kind of threw in some deceptive acts, consumer fraud, and other violations. So moving on, these cases do make the headlines. You can see some examples here. Patients suing across the country over hospital records accessed by Facebook. And I've already shown you the mechanism by which that can happen. WakeMed faced a class action for, again, Meta Pixels. That's also Facebook. You have Community Health Network, notifies 1.5 million patients, I assume, of a data breach from tracking tech. And then another one as well, sharing patient information with Facebook and Google. And I think really the issue to think about here is, as a provider, has there already been a breach? Has there been tracking technology added to the website that may be relaying this information to these third parties in violation of HIPAA potentially? And that's something that we can help figure out. And we encourage our clients to do that and reach out. So kind of wrapping this up, what should you do? The top recommendations are to remove tracking from all the web pages where the visitor interactions likely constitute PHI. As I mentioned earlier, if it's authenticated, so if a patient actually logs in, that's a pretty big no-no to put tracking technologies on that site. For others, also, as I mentioned, there's kind of a gray area where you're living, and we can help figure out, are we on the risky end or sort of on the less risky end of that gray area. We also recommend that our clients adopt a policy for web development that prohibits adding tracking technology without at least some higher level review and approval by somebody who's familiar with these HIPAA and private lawsuit issues. We also recommend training of marketing staff on the requirements of HIPAA that apply to the website and marketing campaigns. And finally, there are tracking vendors that actually are HIPAA compliant, or they say that they are, and crucially, they will agree to sign that HIPAA Business Associate Agreement, or BAA, for these functions. And that's something that we can help negotiate with them as well. So finally, recommendation to audit your website. If you do have tracking technologies or are curious, you can even ask one of us to see what our detection tools reveal. And as I mentioned, kind of one question that some health systems have been asking themselves, have I already breached HIPAA? Do I have to think about potentially contacting the government? How do I even analyze this, my situation? And we can assist with that. As mentioned, there's state law exposure in private class actions. So under HIPAA, if you breach HIPAA, you'd be responsible for conducting that assessment and then taking the lead on providing the patient notifications. And depending on the details of the breach, for example, the number of patient records that were breached, there may be additional reporting requirements as well. These could be federal, as well as in some states like New York. New York actually has a state data security provision in one of the newer laws that requires certain HIPAA breaches to actually be notified to the New York State Attorney General. You may have to offer credit monitoring, contact other state agencies, or set up a call center to help those patients. I think, yep, that wraps us on tracking technologies. So Zach, why don't I turn it over to you on
Sure.
these copyright issues?
Thank you.
Zach, before you start, I'd just like to remind our participants that if you do have questions, use the chat feature, and Zach and Teresa will do their best in answering those questions for you. Thank you. Sorry, Zach.
No, of course. Yeah, we welcome questions if people have them. So with copyright issues, people with their websites want a unique experience for their patients who come onto their website, and that can be done by adding content to your website. And so people think that if you find something, you can kind of use it, and that's the reality is that that's not true. If you take content from somebody else and you weren't allowed to, if you've infringed their rights in their content, you can be held liable. And depending on the facts and circumstances of what you took and how you took it, it can be from a couple $100s to 6 figures. We have found that a lot of people will settle cases, and that can sometimes be settled in the $2,000 to $10,000 range. But that's just an estimate of what we've seen. Things can get much more expensive. So the question to ask yourself is, what content is on your website? Did you hire third parties to give you content, like a photographer? And if so, did you in the agreement you have with that photographer, do you have the right license to use it? Did you make it work for hire where you now own that content? There are websites like Shutterstock where you can get stock photos. If you have an agreement with Shutterstock, then there's usually a repository where you can take photos that you can use on your website. Or do you have a web development agreement with a vendor who is building your website for you? And if so, did you put in that the vendor has to be using original work that vendor created, or work that they're allowed to use? As a the practice that owns the website, you're going to be responsible for the infringement by your employees or your vendors. So some people might just say, oh, my nephew, he's really good at websites, I have him put in everything. And that's great, but you're now responsible for what he's doing. So does he or she know what they're doing? Are you training your staff or whomever updates your website on this? That's the big question, is just, do you know what's on your website and how you got it? We'll go to the next slide now, which is, do you have content on your website that you want to copyright and you want to be able to make sure that others can't use it? A lot of people create content on their website but might not copyright it. What can happen is, if you're not copywriting it and people are able to take it and use it, you create situations where this can hurt you on multiple levels. One is that people can get confused and they might go to someone else's website and get services from them because they might have thought it was your website or your content. Or on search engine rankings, when they type something in, because multiple people now have your content, you might not come up as high. You might also not be collecting damages from others that are taking your content because you never copyrighted it. So, if you do create content, you might want to look into copywriting that content. There's also third-party vendors that, will provide these types of services to you. But, anyone who's putting a lot of their own content on their website, this is something that you should think about. So going on to the next slide. This is, sometimes it seems obvious, but a lot of people can trip up on it. And this is responding to online reviews by patients. Patients can put reviews about physicians in a lot of places. They can go to Yelp, they can go to Google, they can go to a bunch of different places to say, I had this experience with this doctor. And patients are free to do that. They're allowed to say what they want. But a patient saying something does not now give you consent from them to respond. And just by acknowledging a patient-doctor relationship, you're violating HIPAA. So if somebody puts a comment on Yelp saying, Dr. Jones is not a great doctor, don't go to them. If you comment and you say, well, you never complained when you came, you've just acknowledged that person's a patient, and that you violated their rights under HIPAA. So you have to be very careful about how you respond. There's also other issues. You shouldn't be asking only good patients to leave reviews. You shouldn't be review gating, which is only taking like the best reviews and putting them on your site. There was a FTC case in which somebody did get a $4.2 million. They had to pay $4.2 million to settle this case because they were review gating. So if you do respond on the next slide, if you do respond to a patient interaction and you violate HIPAA, there can be serious consequences. If you have a history or pattern of it, that can add up to what your HIPAA fine might be. And the fines can be large. There was a $30,000 fine to someone who was responding to negative reviews. There's this one that's up here with the quote. It's worth reading the quote. It was a $50,000 fine by the OCR, which is basically the highest that they can give for one single incident. This dentist just put a plethora of information and just really vented on this patient. I mean, he says, you came to my practice on 2 occasions. He said it was for a root canal treatment. He basically calls him an idiot several times, tells him to get a life. He also didn't take the review down, and I don't think cooperated with OCR, and that's what led to that fine. But again, all it takes is one instance in which you did this, and if a patient complains about it, OCR will investigate, and they can take action against you. Next slide. So the recommendation is don't respond. Don't respond online to reviews. If somebody said something that you don't agree with and they're a patient of yours, you should really talk privately with that patient, next time they're in the office or on the phone with them and find out what happened. Maybe there was a reason for it. Maybe by talking to them, they'll take it down or they'll edit it. If you feel like you have to respond online, you have to be very careful about how you respond. You can only respond in general to them with kind of, here's our standard protocols, here's our policy. So you can say our practice is committed to providing quality care. You can say, thank you, we appreciate all comments. But it needs to be something very general where it doesn't, you have not acknowledged any sort of patient relationship. And again, you are responsible for your employees. So if you have people monitoring your social media websites or monitoring your any types of reviews that people are leaving for you, if they make a comment, you're responsible for it. So you need to train and you need to have policies on how any sort of online review responses should be done.
So Zach, before moving on, there was a question here. So what do you think of the idea of having physicians or their practice asking upfront for a patient permission to be able to respond to social media posts, positive or negative?
It's still probably not a good idea to put that, because you don't want to be also just getting into public fights with your patients. on where everyone can see. And if, and even if you do have a consent, depending on how you respond, the patient could say, I didn't really understand this consent. I didn't know this is what it meant. I didn't realize that they would say, things like this. I don't think it's the best idea. Again, it depends. I mean, if you're just going to say something a certain way, maybe, but I don't think it's a great idea to go down that road.
Yeah, I think I'd agree. I'll advance the slide here, and there was kind of a part 2 to the question. So, isn't even a general response an acknowledgement of a physician-patient relationship? And I think, absolutely see, even saying, thank you for your feedback, I could see how that may be interpreted potentially as acknowledgement. So we actually work closely with our colleague Stacy Gulick, who is able to review template responses, and those are some of the examples that she provided in certain situations. Just, really, it's, if you absolutely must respond, definitely don't include any individualized acknowledgement of that patient. But I think, the thank you has been in the realm of sort of, just like a general interaction. And it's not that the interaction necessarily ends there. I think Stacy has also advised clients to, have their health records or other folks internally, reach out directly to that patient if they can identify who it was and figure out what the, what the issue was. I don't think anybody wants to provide bad care or have dissatisfied patients. So there is a second step that can be taken to remediate, but it just can't be done publicly or even privately online, as is this next topic that Zach is going to tell us about.
Yeah, again, it's always the best practice to not get into that. Do it privately, do it by private, I mean, on a phone call with your patient, or next time they come in. So yeah, this just kind of goes down a little bit deeper into, what if you have a social media, if you're chatting with your patients on social media, or you have your own patient group, and these things just are not smart ways to communicate with your patients, because there's a lot of ways you can cross the line. You shouldn't be chatting with your patients on Facebook or Instagram or Twitter. And these, a lot of common platforms, they're not HIPAA compliant. So you are, even if you think it's private, it's not really private. It's kind of like with the tracking issue. You can be saying things, and Facebook might be able to obtain everything that was just said in that, what you think is a private conversation, and use it. So you shouldn't be chatting with patients over social media, and having a social media group. Again, there's a lot of ways to trip up on this. The best way, if you're going to do it, is to allow there to be a group. Don't gatekeep it at all. Let anyone who wants to join in, and you really shouldn't be communicating other than maybe you could put up an interesting article that affects, if you're a dentist and there's an interesting article about dentistry, you could post that, and your patients can comment on it all they want, but you shouldn't be directly talking to them about stuff affecting their health on this. Yeah, then the next slide, we're going to start getting into website design and assessment. I'll let Taras start the conversation on a couple of these issues.
Yep, and just kind of wrapping up that earlier topic.
Yeah, were you about to say there was a question?
So I see this question here. So I'll take that in just a moment. In terms of these, the Facebook groups, for example, sometimes patients may create them, sometimes practices may create them, and they could really be valuable tools, I think, for, moral support, for example, for families who are receiving, maybe with children receiving treatment for certain types of cancer, or other types of maladies and diseases that they're being treated for, to form a community. And that's certainly, you know, a very helpful thing for them and community for them to have. It's just, and there are ways to set it up, but you know, it can't just, there can't be any gatekeeper as to who's actually joining, because that would reveal who's the patient. But I mean, these groups, you know, they do offer a lot of support for those communities. So we do have a question here. Is it okay to answer general questions? For example, when will you have more flu clinics? Yeah, I mean, that's, you know, it's not tied to any particular patient. I would say that's fine. Zach, would you agree with that?
Yeah, that's fine, but again, the devil's always in the details. If someone says, you know, last time I came to your office, you mentioned there might be more flu clinics in, you know, in February, is that still true? Now, if you say, you know, yes, you might be revealing that they are a patient of yours. So it's just always, depends on exactly what it is. But yes, if it's very basic like this, and then yes, you can answer those questions, but you just always have to be careful of what exactly the question is, how you're answering it. Are you showing that there was a patient, physician-patient relationship?
Yeah, I would agree with that. All right, so moving on to, I guess our final couple of slides here. So we have some additional considerations, items that we've come across over the years and have advised clients on. And these deal with website design and assessment. So the top point here, website terms of use and privacy policies. So these, you know, certainly seem like some housekeeping topics. I know that we're all used to websites having terms of use and privacy policies. I would, you know, I think the way that we look at them, so terms of use can be pretty basic, formulaic, and by basic, I also mean cheap, because they don't take a lot of time to pull together. But they do serve as a low-hanging fruit for practices and healthcare providers who want to be certain that they're cutting off liability for example, content that they post to their websites, functionalities that they include. So whether you need a terms of use, I mean, I think for a basic website, you can also have very basic terms of use. If it's informational only, then you probably want a statement to make sure that nobody who's visiting your website would be able to sue you for information that perhaps turned out not to be altogether accurate, didn't meet their situation, and then they went and did something and suffered some harm. There's a lot of different ways, fortunately or not, that people can sue businesses and other people. And the terms of use is one tool that you can publish on the website. It doesn't have to be intrusive. You don't need, you know, a full click banner like with the cookies or anything like that necessarily. But there are ways to add this and draft up a very simple terms of use for those simple uses. Now, if your website includes other functionality, like if you can purchase, I think my dermatologist, for example, has like a whole store where you can purchase different types of creams and sunscreens and things like that. Maybe your website has, you know, an Ask a Physician feature. Not sure how advisable that would be if it's not through a patient portal that's protected or HIPAA compliant. But if you do have those types of functionalities, then you may want to think, you know, how can this sort of land me in trouble if somebody has a bad experience? Or, for example, if somebody uses your website to schedule an appointment, but for some reason that message doesn't actually get scheduled, or that appointment doesn't get scheduled in your system, they come in and they're unhappy and they could, you know, threaten some type of legal action, then you would be able to use your terms of use to say, no, there's nothing here. We're going to enforce this and you won't be able to sue us. And then the problem kind of goes away, hopefully, in that situation. So that's really the utility here. As for privacy policies, these we sort of take a bit more on a case-by-case basis. As healthcare providers, of course, you would already have your notice of privacy practices that applies to patient information, the PHI, which is protected health information under HIPAA. And if that's really the only type of information that you may be receiving from visitors to your website, then, you know, we may not recommend having a separate privacy policy unless it's required by by local law, meaning state law. So, for example, in California, we have certain clients that do have practices set up or offices set up in California, and in other states where state law, like for example, California does require publication of a very specific type of privacy policy, so that we can also assist with. As for others, just I think the one thing to definitely not do is just to copy someone else's privacy policy and then republish it as your own. There's a number of issues and risks with doing that. The second item here, ADA compliance. So ADA is the Americans with Disabilities Act. I think originally this was really more geared towards kind of brick and mortar facilities, and then it was expanded years ago to the websites of businesses that have physical locations, but this was sort of an online digital counterpart for that. And there are ways to sue those types of establishments if their website basically doesn't allow the same type of interactivity or functionality as going into the store. Certain states are actually starting to enact baseline standards. So California, again, they enacted a requirement that websites have to meet a set of standard guidelines called the Web Content Accessibility Guidelines. So that's starting to become enshrined into law. As to the East Coast, I haven't really seen that pop up yet, but it doesn't have to be part of the state law to permit somebody to not think about it on a federal level, because we have seen suits on the federal level sort of across the country. So you do want to definitely put some thought into this. You could consider auditing your website to confirm compliance. One thing that I've actually seen is certain consultants, they actually hire individuals who have different visual or mobility types of impairments, and they therefore are very familiar with the tools that are used to increase website accessibility, so they can hit certain keys, access certain content, skip past other content, and help move around a website with those features. And so they can kind of take a spin through your website and then report back and say how their experience was, and then you can follow up and try to maybe change those features. It is something that's easier, I think, to build in from the ground up. So if you are looking at a total website refresh, maybe that's something to keep in mind to do. And also on this topic, I've worked with a number of clients who wanted to add what's called an accessibility statement to the website. Accessibility statements, they tend to be short, and yes, they would be a legal drafting project. It'd probably just take maybe a couple of hours at most, basically describing how the website has been made accessible, whether the business that's offering the website, for example, a medical practice, is aware of any accessibility issues that they're working on addressing or making something easier, maybe offering some tips, around those issues for whoever ends up at that accessibility statement. But I think also important to keep in mind is that just publishing it doesn't exhaust all of your compliance obligations under the law. So there are operational requirements and design items that have to be addressed on the website itself in order to stay accessible and avoid some problems. And we have seen this come up in the healthcare space increasingly. Zach, you want to take the next one?
Yeah, so then another key point is managed service providers. If you have a vendor that you are hiring to basically provide you a service, like you want somebody to run your website for you, you want somebody to run your social media accounts for you, you need to make sure that you are setting it up in a way in which you own your own URL, you own the account, you have full control of the codes and the logins, because we have had situations where a client hired a vendor, they didn't set it up this way, the vendor actually controlled everything, and then there's a disagreement, certain payment wasn't made, or the doctor was going to fire the vendor, and the vendor just locks you out, and now you have no control of your website, you have no control of your social media. So you have to make sure if you're hiring vendors to do these things for you, that you're setting them up, that you're setting up the contracts the right way, and that you're setting it up from a operational standpoint the right way so that you always have control. And just another reminder about HIPAA risk assessments. Under HIPAA, providers, covered entities are required to do periodic assessments. Most people take that to mean that on a yearly basis you have to do a risk assessment. This identifies, risky activities and how you can take precautions of how you're collecting, storing, processing PHI. And a lot of times your website is going to be a component in that. So you can't forget to include this on your risk assessment. And you can't forget to do a risk assessment. We have a lot of clients who never do a risk assessment. And if you ever get into an issue with OCR about HIPAA, the first thing they're going to do when they investigate you is to ask you for a copy of your risk assessment. There is a tool on the Health IT website that can help you with how to do these. Or, these are also things that we can help you with. Depending on how big your practice is, it might not be that big of a lift to do these things, but it is extremely important to make sure you're doing HIPAA risk assessments.
All right, and I'll pick up on this slide. So information blocking rules. I'm not sure if folks on this call have heard about information blocking restrictions. So basically it kind of is what it says. So these are rules designed to prevent the blocking of patients receiving their own health information. Now you may be thinking to yourself, if you have familiarity with HIPAA, you already have an obligation and a duty to provide patients their own health information, and that hasn't changed. So in a sense, these are new rules. But as they're applied between a physician and a patient, a lot of what's already in place remains in place. But these rules may change some of the timing of responses, some of the processes that may be used. And just, for context, these rules also apply to health IT providers, health information networks, and entities like that, which is why, they're kind of broadly written. And so here we're just trying to apply them to this physician-patient relationship. Very broadly, the rule says that the healthcare provider cannot interfere with, prevent, or discourage access, exchange, or use of the electronic health information. And the reason that this is mentioned in this presentation is because of the patient portals. So patient portals are something we get asked about in questions about information blocking all the time. Do you have to provide all of your notes immediately? Can results be delayed from the patient portal? Do I have to buy new technology to enable a patient portal so that if a patient asks for it? So there are different considerations for each of those questions specific to a situation. Just on that last point, you don't have to go out and acquire new technology just to provide a patient portal. But if you do have an EHR EMR system currently with a patient portal capability that's disabled, but a patient would like to use it, then I think that's something that should definitely be considered. And as a final sort of small point on this, if a patient requests to interface one of their mobile health apps, and there's more and more coming on the market, if they want to interface that to their medical record with your EHR, those requests have to be taken seriously. There needs to be a review of the request, whether it meets certain requirements. I've seen sort of third-party app providers come in and try to get access without actually naming any patients or naming any providers. So those we've handled kind of differently, but those have definitely been taken seriously as well. So we just wanted to point that out and get that on folks' radar. Next point here, so health data privacy laws. So we know that we have HIPAA specifically on the federal level for patient health information. You're probably also familiar with comprehensive privacy laws in states like California. I believe Connecticut also now has one above a certain threshold for for-profit entities. But certain states, namely Washington, at this point, they're also starting to pass laws that are very specific to just any health data, even when it's not with a provider. So, if you're curious about that, we can talk about it. Typically, these laws do exempt covered entities under HIPAA. So the way that they may apply to medical practices is not completely or altogether direct in every case, but that's a conversation that we can certainly have if there's any concern. I think the one trend that should be pointed out is that precise geolocation and geofencing, there's a lot of state legislative activity for those types of tracking. Being able to place an individual at a specific place at a specific time, that is very personal health information, and so a lot of states have been passing laws that specifically regulate that. Connecticut does have one. It has certain exceptions. If you're worried about that, or if you're interested in using geolocation or geofencing with your website or marketing, we would encourage reaching out to one of us or another legal advisor for some advice specifically to the Connecticut laws. I think that leaves a couple minutes here. So just offshore vendors, I don't know, Zach, did you want to say a couple words? And then
if you're working with if you know that any offshore vendors are providing you a service, whether it's big or small on your website or just in general, you just have to make sure that you're careful, because certain of your payer contracts might prohibit you from using offshore vendors, or you want to make sure that there's the right data security language in any agreements you have with offshore vendors. Just because, again, if things are offshore, your data is a little bit, it's harder to, if there's an issue, it's harder if they're offshore to get to really go after them. So you want to make sure that you're protected in the right way.
right. All right. I think that takes us to questions. We had some along the way.